Good evening, everyone. My name is Dr. Sritha Rajupet, and I'm the primary care lead at the Stony Brook Medicine Post-COVID Clinic in Long Island, New York. I would like to welcome all of our viewers today as we discuss our topic, post-COVID, in it for the long haul. I'm joined by experts from our post-COVID clinic, the first of its kind in Long Island, as they discuss these long-term effects and approaches to care. I would like to take a moment to have them introduce themselves and their relationship to our clinic.
Hi, I'm Dr. Agnieszka Kowalska. I'm an associate professor of neurology here at Stony Brook University Medical Center.
Hi, my name is Dr. Jenna Palladino. I'm a clinical psychologist and associate professor in the Department of Psychiatry and Behavioral Health at Stony Brook Medical Center.
And I'm Abigail Chua. I'm assistant professor in Division of Pulmonary and Critical Care Medicine here at Stony Brook University Medical Center.
Thank you all for being here today and sharing your expertise. Although we will not be addressing questions live throughout this broadcast, we will review any questions left by our viewers and address them after today's discussion. According to the CDC, although most people with COVID get better within weeks, some experience long-term effects. What do we mean when we say post-COVID? Is it different from long COVID?
The CDC talks about both post-COVID and long COVID under the formal definition of post-acute sequelae of SARS-CoV-2, which is referred to, like I had said, as post-COVID or long COVID or sometimes COVID long haulers. And this refers to a wide range of new, returning, or ongoing health problems that occur 4 or more weeks after being first infected with the virus that causes COVID-19. And it's really a large array of symptoms. Some of the common symptoms include difficulty breathing, fatigue, concentration difficulties, headache, and changes or loss in taste or smell.
So what are some examples of long-term effects of COVID? Might be having some difficulties here. Is Dr. Kowalska able to?
Can you guys hear me? So from a neurological standpoint, we know that multiple studies have shown that about 35% of patients will have some kind of neurological complication after COVID infection. We know that COVID-19 can infect the central nervous system, peripheral nervous system, as well as skeletal muscles. So we can kind of divide the symptoms and signs into 3 groups. So for patients who present with central nervous system complication, the most common symptoms that we encounter in our clinic are headaches, short-term memory problems, brain fog, dizziness, fatigue is also a big one, as well as some confusion and difficulty with focusing. For peripheral nervous system, patients typically complain about numbness, tingling in their arms, in their legs, as well as a loss of taste and smell. And for skeletal muscles, we encounter patients reporting myalgias, muscle pains, and aches.
Dr. Kowalska, are there any factors that might predispose someone to post-COVID conditions if they had COVID?
So we're still learning a lot about COVID itself, and we're learning even more about this post-COVID complication and risk factors. We know that patients who have been admitted to hospitals and have severe COVID, they're at higher risk for developing post-COVID complications. But with that said, in our outpatient neurology clinic, majority of the patients that myself and my colleagues see are actually patients with very mild to moderate COVID symptoms, but they still experience some neurological complications. And these patients were never hospitalized or never require any supportive treatments. So no, right now we really don't have any good predictive factors.
How long are post-COVID symptoms expected to last then?
Well, studies have suggested that most people's symptoms really improve within a few weeks, but some go on to have more persistent symptoms, and these symptoms can last 6 to 9 months, sometimes even longer. And we also see that some patients' symptoms really wax and wane. So some get better over time, while others report a more cyclical pattern of getting worse or better. COVID has existed in our life like for 2 years. So studies are ongoing because post-COVID has probably only existed for that long.
Well, persistent symptoms or a cyclical pattern of symptoms must be very challenging to a patient's physical and mental well-being. Dr. Palladino, do you mind telling us how people in the support group you lead have dealt with this and what coping mechanisms you would recommend?
It's a great question. It has been very difficult for people to manage these symptoms over time. And the support group was developed in response to the unique experience of our long haulers who are really feeling and are continuing to feel isolated and alone. The group provides a place for survivors to share their experiences with each other and really normalize their experience. Our group members are the people with expertise in this as they're living it every day. So they're able to learn ways of managing their symptoms, as well as sharing some common coping skills that can be helpful. So a great example is chronic fatigue. That's a common struggle for many individuals with post-COVID symptoms. So we'll often talk about a concept called pacing and how to best use pacing in our lives. And so pacing is when we work to balance rest and activity, so moments of energy conservation with energy exertion, to try to avoid that boom-bust cycle that can happen when we're living with chronic fatigue or chronic pain, and finding that middle path or that middle ground between doing things that we want and need to do without overexerting ourselves and then setting it back.
Dr. Kowalska, I know you've seen many patients with fatigue as it's one of the most common post-COVID symptoms. How do you approach diagnosis and care of fatigue?
So fatigue, as you guys know, it's very difficult to assess. That is such a subjective symptom. And in most cases, in our clinic specifically, we try to use the general functioning fatigue scale. So we rate the patients on a scale really rates the patient 0 to 100. 100 meaning patient has no symptoms, 0 severely debilitated. Most of our patients that we see in our practice fall anywhere between 60 to 70. So the score indicates that they have some functional difficulties in their social, occupational, or school functioning, but typically they're able to get around. That's the most common that we have encountered in outpatient setting.
Great, thank you. How many treatment sessions of like vitamin infusions would you recommend if that's another option?
Yeah, so for the treatment, I should actually mention that. So when we recognize the patient suffers from anywhere from moderate to severe fatigue, we're able to offer them some treatment. So one of the treatments that we offer is medications like Provigil. It's an oral medication that patient can take at home. And it's a sort of a neurostimulant that works by promoting wakefulness. So that's something they can do at home themselves. Another treatment that we have been sort of non-conventional treatment that we've been doing in our clinic is providing these patients with infusions of high dose concentration of vitamins. It's like a cocktail that consists of high concentration of B1, B6, vitamin C, B12. So we actually found that quite a few patients reported an improvement in their fatigue and overall functioning. Unfortunately, the period of improvement, usually it's short. It lasts for about 4 to 6 weeks, sometimes a little bit less. The way this works, we give patients infusion once a week for about 4 weeks, and then we assess them. We're usually able to give them another infusion 4 to 6 weeks later if they tolerate okay, if they have no side effects. And again, the side effects are very mild, and especially if they did experience some improvement in their symptoms.
Dr. Kowalska, for patients who are taking supplements already of vitamins, is it safe for them to continue with infusions as well?
So yeah, so a lot of oral supplements over the counter have very low concentration of these vitamins. So what we do is a very high concentration. Sometimes if patients do take higher concentration at home, you're able to check the levels, especially B12 and B1, because you don't want to make them toxic. And if those levels are low or on a low therapeutic level, you definitely are safe to infuse them.
Great, thank you for that clarification. I know sometimes fatigue can be a result of shortness of breath, another common post-COVID symptom. Dr. Chua, can you tell us about your approach to shortness of breath?
Well, shortness of breath is really one of the most challenging aspects of post-COVID syndrome. Part of our approach as a pulmonary division has been first ruling out any other causes of shortness of breath. Our physicians send patients for rigorous physiologic testing, including testing of their oxygen levels, seeing if they require supplemental oxygen, testing to see if there's a response to bronchodilators, and oftentimes we send patients for cardiopulmonary exercise testing, which gives us an idea how well the heart and lung are functioning.
Claims that cardiopulmonary exercise testing offers further clues in complex cases and helps guide treatment approaches. It's great to know that Stony Brook Medicine is able to offer these types of tests.
Well, cardiopulmonary exercise testing usually involves having a patient perform exercise, sometimes on a treadmill, sometimes on an exercise bike. And while they're exercising, we gather real-time data about their cardiac rhythm, their rate, blood pressure, oxygen consumption, and breathing patterns. And this gives us a comprehensive look at how well the heart and lungs are working in real time and helps to tease out whether a cardiac or a pulmonary abnormality is present. It also helps to identify when the culprit may be something such as deconditioning, which many of our patients suffer from, especially if they've been hospitalized. We're really lucky as a division to have pulmonary physicians on staff who are really highly skilled CPAP interpreters, including my boss, Dr. Smeldone. Many of us use CPAP as a test when we have patients whose shortness of breath may not easily be explained by pulmonary function testing alone or radiology findings. And we've used it to identify cardiac limitations in our patients. So for example, I had a patient with postural orthostatic tachycardia syndrome. So we had, which was identified on CPET. So we've used this data collected to better guide our patients and also help when we're referring them to pulmonary rehabilitation.
Great. I know, especially for those who've exhibited signs of deconditioning, we've also been referring our patients to the Stony Brook Tai Chi program, which is free and available to patients online, which many have reported as being helpful. So both fatigue and shortness of breath are very challenging symptoms to deal with, and especially with the stress of the holidays around the corner, what are some helpful tips to maintain our well-being? Dr. Palladino, I know you always have a lot of good suggestions.
You're right. The presence of these ongoing long COVID symptoms can really increase stress at a time of the year that's already can be very stressful for people. And when we're looking at supporting our mental health, we should often start by looking at our lifestyle overall. And so things like exercise and finding ways to move our bodies in whatever way works best for us. So for some of us, that's formal exercise, that's running, hopping on your Peloton or whatever it may be, taking a YouTube class. But for others, it's finding social ways to exercise together, going for a walk, taking the dogs out, doing yard work on warmer days, things like that. Whatever works for you to really help you manage stress and improve your well-being. And also pairing that with eating healthy and really limiting your alcohol and substance use and making it fun to try new healthful recipes, nourish our bodies, and try something new.
Do you have a favorite recipe that you plan on trying this holiday season?
Well, the holiday recipes don't always work with some of the more healthful goals, so you try to infuse healthy where you can in them. So trying to eat, I'm a big fan of fish, so I always try to make a lot of fish dishes. So it's a leaner protein that still tastes really yummy and doesn't leave me feeling quite so uncomfortable after. It kind of matches physical health and enjoyment.
Great. I know it's also hard around this time of year to make sure we get enough sleep. Can you tell me a little bit about sleep and its importance to well-being as well?
Of course, yeah. So sleep is one of the other areas of lifestyle that's really important for our physical and mental health. And so finding ways to maintain healthy sleep and healthy and helpful sleep practices, such as limiting your time in bed, avoiding napping, and doing things that can help you get more restful sleep at night will really help feeling better throughout the day.
I know many of my patients have reported to me that before bedtime they have a habit of watching TV or scrolling through social media. Can you tell us how that might affect their sleep or mood?
Of course. So Screen time in bed is a really common thing that I think we can all be guilty of, and sometimes we don't realize the impact that can have. So the light in our phone and TV, they cue the alert center in our brain, which can actually take about 45 minutes to turn off after we stop having screen time. So it's really important to, when possible, try to minimize that time. And for those of us who like to use sound or distraction to help fall asleep, things like music or white noise are typically a much more effective way, because they can give us that period of time without screen to help our brains better fall asleep and fall out of that alert time.
Thank you. I know some people even have these blue light blocking glasses that they've started using in the evenings. We'll have to see how well they work.
Another thing that can be problematic or not helpful with scrolling on our devices is the exposure we have to social media and news outlets. So at sleep time, that's not always helpful, but even throughout the day, it's really important we stay aware of current events, but limiting time on social media and news outlets when it can constantly be in our face is another way to help our well-being and manage stress, especially around this time of year when there can be so much coming at us all the time.
I know, especially for me, just dealing with COVID all day at work, and then it's surrounding us in our everyday lives has been so hard, and I've been grateful to have my family and friends as support, and I'm so grateful to you to lead the COVID support group, so others have different types of outlets as well. So thank you for that. How do you encourage us in other aspects to continue to maintain healthy living?
So thank you for your thanks as well. And one of the things I think that can become really important is maintaining structure and routine. So many of us are working in the office, but many of us are still able to work remote, which really changes the flow of our life. So finding ways to still have the structure and routine where you unplug at certain points, you find ways to stay connected with your loved ones, exercise, set up a routine that can help you do some of those earlier skills we talked about is really important. And like you said, connecting with your loved ones, whether that be through Zoom or FaceTime or whatever it may be, a video support, or finding small group gatherings with those who you're taking appropriate precautions for, or connecting with family is really important.
I know one practice for me that's been helpful has been yoga and meditation. Can you tell us some more information about that and how that might be helpful for others?
So yoga is a nice blend of both meditation and exercise, and one that can really help us manage stress and calmness. And so whether we're using meditation in a formal practice, through yoga, or through connecting with deep breathing, really has shown over time to increase calmness and decrease stress. And there are a number of free apps people can use, such as Insight Timer, or apps that you can purchase for a small fee, as well as YouTube videos. And so those are really helpful ways to engage in meditation. And if you're feeling like those apps aren't for you, there's really simple ways we can use our breath to calm us down throughout the day. And I always recommend the breath, because as simple as it sounds, we always have our breath with us. And so no matter where you are, you have a coping skill with you. And so for those of us that are interested, we can kind of walk through how to do something like this really briefly. And so if you're feeling anxious at any point in time, or stressed and wanting to recenter yourself, you can always simply just try to place your hands on your stomach and feel your stomach rise on the in-breath and fall on the out-breath. So kind of switching from that shallow breathing we take, and breathing in for a count of 5, holding the breath for a count of 5, and then breathing out for a count of 5, and then holding the breath out for a count of 5. Doing what we call box breathing. Breathing in, holding, breathing out, and then holding again for 5 seconds. You can see it makes a box with each option. And when in doubt, you don't feel like you have those moments, always connecting your feet to the floor and really using that to remind yourself that you're grounded and stable in these moments.
that boxed breathing, I know, is something I could definitely improve upon, maybe, something to try between meetings. So we have the new Omicron variant present in our community, as I'm sure we're all aware of. We know the importance of fun as well. How do you recommend people have fun while staying safe?
Fun is also a really important coping skill, and one of the safest ways to have fun and connect with others is outdoors. So finding ways to spend time in nature or spend time with your pets and really fostering creativity. When we have less social interactions going on because of some of the social distancing we're continuing to maintain, it opens up a door for us to have time to build a new hobby. And so spending time either learning something new or reconnecting with an old hobby can really help us improve our moods and bring joy into our day-to-day life. And the great thing with all of this IT and connectedness we've learned is so many classes and things are now available for us free online or through other options that we can really get that skills and training in.
I know one activity that I hope to do outdoors this summer, or this winter rather, is ice skating. I feel like it's been a really long time since I've been on the ice, so I hope to pick that up again. Maybe I'll see some of you guys in one of the rinks nearby. So we've been talking a little bit about how we maintain our sanity through all of this. Now, if a person gets COVID, is there a way to actually prevent post-COVID?
So I think the key is to prevent getting COVID. And that's the best way to prevent getting post-COVID symptoms. Obviously, we know that vaccinations help prevent COVID. With newest studies that are currently coming out, we know that even patients who contract COVID, but they're vaccinated, they're at a lower rate of having post-COVID symptoms, especially neurological symptoms. So that's one way of preventing post-COVID symptoms.
Yeah, as a pulmonary division in the last couple of days, myself and my colleagues have been seeing an uptick in a number of unvaccinated patients who are unfortunately suffering from COVID right now in our own hospital system. And again, as Dr. Kowalska says, by far the most effective means of preventing post-COVID is to never get COVID in the first place. So that means masking, hand washing, vaccination, and boosters. It's really those types of measures that are really going to be the best protection for you. So to prevent you from having to suffer from some of the symptoms that so many Long Islanders are currently suffering from.
Absolutely. And I know in clinic, I'm always talking about the Lancet article that came out a few months ago that talked about amongst those patients who are vaccinated and had breakthrough cases of COVID, they were 49% less likely to develop post-COVID symptoms. So that's given me some hope as we've discussed this in our clinic. Dr. Palladino, from your work in leading the COVID support group, can you talk about what factors have helped some patients cope with this new illness and what's maybe influenced their resiliency?
So there are many things that can really help, and it's important. One of the biggest factors that influence resiliency is people's self-compassion and their ability to be kind to themselves as they sometimes struggle with the post-COVID symptoms. So in addition to all those healthy lifestyle techniques we talked about earlier, having support from others and having that compassion is really towards yourself are really key components to managing that stress from long COVID. And one of the reasons is that helps us be gentler and gentler with ourselves and find ways to build hope. And so I encourage everyone who is struggling and wants to increase their inner resiliency to reach out to your loved ones and share your experience. And if you're feeling like your loved ones are getting it and doing a great job getting it and you need more from them, or maybe just aren't quite getting it, find a connection through other survivors. So there's things like Survivor Corps, the support group that we're offering here, as well as other support groups that you may find in the community can really increase overall well-being and help remind us all that we're not alone. And everybody's experience of post-COVID is different, and yet we still have so much overlap that we can learn from each other. And so think it's important to find connection where we can and to just weave in as much self-compassion as we're all learning and growing together.
As you mentioned, hope is definitely a powerful thing and something that I know is difficult to hold on to, but one that's so important, especially at this time. So as we approach the end of our time this evening, I wanted to thank all of our panelists for their time. Navigating a new and evolving conditions such as post-COVID is certainly challenging, and I sincerely appreciate their time and dedication to our patients. To our viewers this evening, please feel free to submit any questions you may have. We will certainly be looking at them after this broadcast and will be responding. If you are interested in making an appointment at our post-COVID clinic, you can request an appointment online at our Stony Brook post-COVID webpage or by phone at 631-638-0597. To participate in our post-COVID support group, you can call 631-638-0597. I just want to thank everyone for joining this evening, and happy holidays from all of us here at Stony Brook Medicine. Thank you.